Doc on the Run. We help injured runners run.
So what do you do, right? So that's what runners always ask me. They'll call and they'll say, okay, well, I got extensor tenosynovitis. What do I do? What's the first thing I can do? And truthfully, with all runners, you've got to heal as quickly as possible. So I, above all else, want you to run. However, I also want you to run as quickly as possible without this going on. So if you have extensor tenosynovitis and you just ignore it, it's going to go on for a long time because the tendons are never going to get a chance to calm down. So the problem with that is that it's not like it's going to rupture, but your running is going to be miserable. You're not going to run as fast as you possibly could because it's distracting you, it's annoying you. And somewhere in the back of your mind, you're going to be concerned that this could get way worse, or maybe I'm making a problem worse, or maybe I'm going to break something, because you don't really know. You're not 100% clear on what the problem is, and you're not really sure that you're not going to make it worse. So that's the thing, is you got to do like something as quickly as possible to try to calm it down. The other thing is that if you have, if your problem is arthritis in the joint and you do something like apply ice, it doesn't really improve it that much, but it will make the extensor tendons improve a lot faster because they're close to the skin, whereas the joints are right in the middle of your foot. They're deep down in there, and the joints are kind of insulated from the surface of the skin with all of that tissue. So if you ice it and you get it to calm down, then it'll improve really quickly. It's not that complicated. The first thing you have to do is, it's itis, it's inflammation. So it's a problem where you have too much inflammation in the tendon sheath surrounding the tendons. You just have to calm the inflammation down. So the way that you do that's really simple. Ice, contrast baths, compression socks, elevation, all the stuff that we think about in terms of reducing inflammation will really make a huge difference. So, if you have compression socks, wear them, sleep in them, elevate your feet, get them way up above your head. Do something to help push that fluid out, and gravity will help push the fluid out. If you're combining the force of gravity by having your feet up, in the legs up the wall pose, having them way up on the wall while you're laying on your back for 15 minutes, and you're wearing compression socks, which squeezes your foot and pushes that fluid out, that will help. Just don't use compression sleeves. If you have compression sleeves or compression socks that actually have a foot section which isn't very tight, then the tight part at your ankle and calf can kind of squeeze the leg and actually hold some of that fluid in and make it worse. So if you wear compression socks, just make sure that they're tight enough to push all that fluid out. But if you do that, if you really ice it, or you do contrast baths and you elevate and you use compression socks and you really protect it and you don't irritate it with shoes that constrict and have laces cranking down on top of those extensor tendons, it will calm down really quickly. So if you do the right stuff initially, just trying to remove the inflammation, it may improve right off the bat.
Doc on the Run. We help injured runners run.